From Acting Premier, the Honorable Diana Rebane. Acting Premier, you may begin.
Good afternoon, Bermuda. Today, I am joined by the Minister of Health, the Honorable Kim Wilson, and the Minister of Youth, Culture, and Sports, the the Honorable Ernest Peets, as we provide the country with an update on the public health regulations in response to the growing threat of the Omicron variant. What we know is that this Omicron variant is highly transmissible. And as the Minister of Health will outline, it is causing a swift increase in our active cases. The government is acting quickly to implement changes that we believe will help to protect our healthcare system and to give our schools the best chance of opening safely in the new year. As a country, we have experience with transmittable variants. We all recall the Alpha variant last April, the Delta variant this autumn, and the severe impact they have had on both our students, healthcare system, and our community. While we don't yet fully know what the Omicron variant will mean for Bermuda, and while we are in a different place than last year with increased vaccinations, boosters, and rapid testing, this government, we will not underestimate the Omicron and the potential impact that it could have. As the Chief Science Advisor for the UK government, Sir Patrick Vallance, has said regarding implementing restrictions, and I quote, "Earlier than you want, harder than you want, broader than you want. You can delay harsher restrictions later." With early and decisive action, we hope to avoid what we went through with the Delta variant, where extraordinary measures had to take place in response to the number of deaths at our hospital and spare as many families as possible from having to grieve the loss of their loved one. This will require us to continue to work together as a community in order to protect public health. I now welcome the Minister of Health to provide an update to our country on our latest coronavirus statistics and the changes to the public health regulations. Minister of Health.
Good afternoon, Bermuda. As we reported yesterday, since the last update for testing completed through the 18th of December, the Ministry of Health received 8,342 test results and 102 were positive for COVID-19, giving a test positivity rate of 1.2%. This brought the total number of active cases to 152, with 151 under public health monitoring and 1 person in hospital. Unfortunately, testing completed on the 19th of December has resulted in a further 21 more positive cases. Where variant typing is available, the majority of our positive cases are now the Omicron variant. As we have indicated in recent public updates and briefings, this variant is highly transmissible. This has been a major concern in other jurisdictions, and now it is becoming an increasing concern right here in Bermuda. Daily, we are seeing astronomical rises in numbers of infections overseas, and the rising numbers are due to this new variant. From what we are learning from those who have been infected, the positive cases are symptomatic, though for those who are vaccinated, the symptoms are mild. These symptoms include cold-like symptoms, fatigue, runny nose, coughs, headache, congestions, sore or scratchy throat, and body aches. So again, if you have any of these symptoms, please stay home, even if you do not think that you are sick. It really is better to be safe than sorry. I recognize that this is typically a time when we would all come together in the spirit of the holiday season, but for these far from typical are our normal times. As you can appreciate, our number one priority is to ensure that we are protecting all of our residents. This especially includes our most vulnerable members of the community. Omicron is indiscriminate, and we must put safeguards in place to not only protect our people, but to ensure that our healthcare system does not become overwhelmed. Today, Cabinet considered and approved the recommendations made by the subcommittee on COVID to reintroduce some restrictions on the island, and they are as follows. Commencing Thursday, December 23rd, the following requirements will come into effect. We will be reinstituting a curfew from 12:30 a.m. until 5 o'clock a.m. The maximum group sizes will be no more than 20 people. Household mixing is strongly discouraged. However, if you must attend a household other than your own over the holidays, we are strongly urging persons to take an antigen test before they visit another home. Masks must be worn indoors at all times and also outdoors when you are within 6 feet of another individual. For restaurants, bars, and clubs, tables will be limited to a maximum of 10 people and must be spaced 6 feet apart. Safe key will continue to be required for all indoor settings. We are encouraging employees who are able to work remotely from home. Along with this, we are encouraging employees to use antigen testing to ensure that their employees who must be at the workplace are negative for COVID-19. Churches will remain open. However, masks must now be worn at all times by all, the officiants, congregations, and the choirs. Gyms can remain open, but safe key must continue to be used and physical distancing must be adhered to. And for personal care services, safe key is recommended for those services that require masks to be removed. This mixture of legislative and guidance changes will slow transmission of the coronavirus. And I cannot stress enough the significance of individuals making the right and smart choices over the holiday season. We must collectively do everything that we can to avoid mass community transmission. As I stated last week, caution must be taken in high-risk settings. The gatherings and Christmas parties which take place at this time of the year, we must continue to exercise caution. Stick to the basics and be safe. Wear your mask properly, practice good hand hygiene, and physically distance from those that are not in your household. Consider prioritizing your outings and do not try to do everything. Try to minimize mixing households. Take an antigen test before you go out so that you know your status. A home test is a quick and easy way to find out whether or not you are infectious. So in other words, know before you go. Take an antigen test before you go out and engage in social activities if you must. We must all follow these safety tips, but as I've said many times, vaccination remains the best defense against the virus that causes COVID-19, and I encourage all unvaccinated people to get vaccinated. Unfortunately, our experience with the Delta wave is that unvaccinated people are particularly susceptible to infection, and in significantly greater numbers, they ended up in hospital, and sadly, many died. Omicron is fast-moving and highly transmissible. That is a fact. And I remain extremely concerned that this variant will spread amongst the unvaccinated as well as the vulnerable people in our community, which could potentially cause another surge in the numbers of people being hospitalized. Do the research and talk to your doctor and make an informed decision about getting the COVID-19 vaccine. There's a wealth of information about the vaccines online at gov.bm. Regarding the booster program, Pier 6 will remain open until December 23rd. Those individuals who are 65 years of age and older who are eligible for their booster, namely that their second jab was more than 6 months ago, they should take advantage of this opportunity before the vaccine center closes for the holidays. If you are 65 years of age or over, you do not need an appointment at Pier 6. Just walk in and get your jab. Furthermore, I'm pleased to announce that booster appointments are once again open for bookings on weekdays at Pier 6 starting January 5th. Second dose appointments will be made for Saturday, January 8th, and thereafter, Pier 6 will administer first and second doses on Saturdays and boosters during the week for the remainder of the month. And as it relates to our outbound antigen testing regime, which we can advise at this time, the Ministry of Health continues working with our healthcare providers and professionals to make outbound antigen testing available through physicians' offices and pharmacies. I do note that the expedited arrival testing has proven very, very popular, and as a result, it is placing some added strain on MDL. Cabinet has agreed to continue the program for a fee of $200 to ensure sufficient resources and timely results. When the expedited process can be based at the airport, which we anticipate will be early in the first quarter of the new year, that fee will be reduced. Finally, this may well be my last briefing before the end of the year. So I wanted to take this opportunity to thank the people of Bermuda for their patience and cooperation as we have navigated the second year of this pandemic. There have been many moments of strain and fatigue, but there have also been moments of grace, courage, and resilience. And I appreciate that this has been a very difficult year for many. I also know the toll that it has taken on so many families, and I know and understand the loss that you have suffered. I also know that this has been a particularly bad year for local businesses. But as challenging as it has been, we are on the cusp of a new year, and with the new year comes hope. We have learned lessons, and as a government, we continue to work tirelessly to introduce innovative ways to help us ensure a safe and equitable Bermuda for all. I must end my remarks by thanking all of the hard-working healthcare professionals in the private sector who have provided their guidance and support. Thank you also to our frontline and essential service workers for their continued support. And of course, I extend my endless gratitude and thanks to the entire team of healthcare professionals and administrative staff here at the Ministry of Health. Thank you for your commitment to the people of Bermuda. Thank you all for your long hours and your dedication day in and day out. You have helped make this country a safe place for each and every one of us. And with that, I want to thank everyone again, and I want to wish all a peace, safe, and blessed Happy New Year and a Merry, Merry Christmas. I now turn over to the acting premier. Thank you.
Thank you, Minister of Health. And thanks to your team at the ministry. And thanks to your team at the ministry and all of our frontline teams involved in testing and vaccinations who continue to work extremely hard and provide Bermuda with one of the best testing regimes and vaccination programs in the world. The regulations announced by the Minister of Health will go into effect from Thursday, the 23rd of December, and will be in effect until at least January 20th. The government recognizes that the regulations announced today will be disappointing for many persons and businesses. We understand that plans will be affected, events will need to change, or may even be canceled. We do not like this at all, and we do not enjoy having to implement such measures at any time, but especially at this time of the year. However, we cannot ignore the rapid pace at which our cases are increasing and the record cases being reported around the world, including the UK, where they recently reported their highest daily total for positive cases for the entire pandemic, with over 91,000 persons testing positive in a single day. We know that there will be pushback, but the government would rather get pushback from implementing a curfew to protect public health than for students not to be able to go into school in 2 weeks. Governing is about choices. I fully understand that many were looking forward to Christmas this year. And while there may be a need to adjust your plans, it will still be possible to have a Christmas with family and friends. Was it the Christmas we thought we would have 3 weeks ago? No. But that doesn't mean we cannot still gather and share our traditions. We just need to be safe. Follow the advice that the Minister of Health has laid out to us today. Utilize the availability of rapid antigen testing and the basic public health guidance that assist in slowing the spread of the coronavirus. To quote the head of the WHO, an event canceled is better than a life canceled. We must all work together to protect life, protect the healthcare system, including our testers and contact tracers, protect schools, and ultimately protect our country. I must also implore those that are traveling, especially during this holiday season, be careful. We are seeing a large number of imported cases coming into the country, with a significant portion being returning residents. To assist the Ministry of Health, additional funds have been allocated for the enforcement, and the regiment will be out to enforce quarantine orders which have been given to travelers and to households with travelers or positive cases as we continue to strengthen our response to this new variant. I now invite Minister Peets to update the country regarding large group events and sports. Minister Peets.
Yes, good afternoon, colleagues, and good afternoon to Bermuda. Certainly these have been very trying times for many sectors in our community. Cultural and sporting events have been severely impacted, and it's very disheartening to me, personally, to have to consider further restrictions to an already stretched sector that are so important to Bermuda's social, mental, and physical well-being. My ministry fully appreciates that health and social benefits of sport and culture, as well as their importance. Nevertheless, we must balance this with the country's need to ensure everyone's safety. Given the increasing cases of coronavirus that Bermuda is currently experiencing, and to protect those vulnerable individuals, our community, additional protocols for large groups will be put in place. As the Minister of Health has said, a curfew will be between 12 a.m. and 5:30 a.m. This means all previously approved large group exemptions, as well as future ones, will be subject to a curfew. A large group exemption does not exempt you from a curfew. Events must end in time to allow persons to safely get home without speeding or becoming a risk on our roads. Additionally, approvals for large group events effective Thursday, 23rd of December, will be limited to a maximum of 50 persons indoors and a maximum of 100 persons outdoors. Events combining indoor and outdoor components will be limited to 50. This will apply to all future applications for the time being. Previously approved events can proceed with their approved numbers, although we do recommend that event organizers limit group sizes as much as possible. The current standard conditions for large group events require all attendees to have a verified safe key. In light of the current situation, we will now also require attendees to take an antigen test on the day of the event as an additional precaution. Event organizers will be responsible for monitoring and enforcing these protocols. Antigen tests will be required for all previously approved events, as well as new applications. For sporting events, this means spectators must produce a safe key and an antigen test. For the sporting group comprised of athletes and officials, the return to play testing framework will remain in effect as a requirement to train and compete. The ministry recognizes that some large group events were approved before announcing these protocols, and we are keenly aware of the impact they have on organizers. However, these precautions are essential to keep us all safe, and the antigen tests empower hosts and attendees to practice personal responsibility and social solidarity to keep us all safe. Moving forward, all large group event applications will be processed under these new policies. Also, as per the standard conditions, wearing masks, contact tracing, physical distancing, and other public health guidance must be followed. I appreciate that these health and safety measures can be an inconvenience and perhaps a challenge to many, but it's also the responsibility of the government to protect the people of this country from harm. And it is our individual responsibility to keep each other safe. To that end, we are committed to preventing the spread of COVID-19 in Bermuda and saving lives. For more information on large group guidelines and conditions, including safety requirements, guidelines for the number of attendees, including hosts, organizers, staff, volunteers, players, coaches, officials, spectators, and vendors, and food and beverage service, the public can always visit www.gov.bm. Thank you very much. Continue to be safe.
Thank you, Minister Peets. And thank you to your team at the Ministry of Youth, Culture, and Sport for their continued hard work. In 2 weeks, our students will be preparing to return to the classroom. And in order to ensure a safe return for schools, the Ministry of Education worked with MDL to put a comprehensive testing plan in place to ensure all of our teachers and students could be tested in time for return on January 4th and January 5th, respectively. Due to the volume of testing required and to allow MDL adequate time to deliver the results, it was necessary for testing to take place in advance of January 4th, when teachers are scheduled to report to work in preparation for schools opening on the 5th. Testing on January 4th would not allow sufficient time needed to process the large volumes of tests and could lead to delays in students returning to the classroom, forcing parents to unfortunately miss work and possibly lose wages in an already decimated economy. The date for public schools, teachers, and staff to book their appointments was originally January 1st, and has since been extended to include the 2nd and 3rd of January to allow more options for teachers and staff to book. I thank our teachers for their understanding and for sacrificing their time as we all work together towards the same goal of letting students back into the classroom as safely as possible. I want to note that the discussions with MDL on Friday past and the subsequent increase in days for testing from 1 to 3 days for staff was inadvertently not related to the BUT, and I apologize for that. As the BUT stated in their letter to the ministry, which I agree, and I quote, "We all have had to adjust during this pandemic," unquote. I can readily admit that all of us have had to make sacrifices since April 2020 that have not been comfortable at times. However, the parameters that we have to operate in sometimes change quickly and suddenly. And I repeat my call for all of our valued educators to sign up for one of the 3 testing days set aside for them to test and get our schools back in. Bermuda, as we head into this holiday season, we find ourselves once again with restrictions that will affect how we would traditionally celebrate with family and loved ones. I urge my fellow Bermudians to also remember those 106 families who will not be able to celebrate with their families this year as a result of the coronavirus. These restrictions introduced are not intended to take away from your holiday cheer with your families and loved ones, but to keep us safe. Please act responsible. Wear your mask, sanitize, and physically distance as much as you can. I also encourage you to follow a healthy lifestyle and build your immune systems. And lastly, do your research and get vaccinated if that is right for you. I want to extend my deepest gratitude to those who have worked tirelessly over the course of this pandemic to keep our country safe. I also want to wish all of my fellow Bermudians a safe and prosperous Christmas season and a happy New Year. Continue to be safe, and we will come out of this in a better place. For that, I am confident. God bless you, Bermuda.
Thank you, Minister. Thank you, Acting Premier and Ministers. At this time, we will begin the question period, starting with Jonathan Bell from the Royal Gazette. At this time, we will begin the question period. Jonathan, if you can mute your device, please. All right, Jonathan, I can see you.
Can you hear me?
Yes, I can hear you. All right, you can begin your questions.
Thank you, everyone. And thank you very much, Michael. Minister of Health, I guess I will start off with yourself. It is what it is. And obviously, as I said last time, I'm not for restrictions, but I'm curious why we didn't have any for care homes. They do seem to be the ones that are right at the top of the risk factor between now and I believe it's January 20th. I didn't hear any restrictions for care homes.
The care homes have their own phases with respect to restrictions and implementing restrictions. For example, all persons that come to visit the care homes, in the first instance, visiting are encouraged to be outdoors. If it's indoors, then persons that visit must have an antigen test. The persons that work within care homes are antigen tested regularly. So they have their own infrastructure as it relates to safeguards. So the rollbacks that we've spoken about today deal specifically with the Public Health Act, but you recall that never have care homes actually been part of that because they have their own phases of rollbacks depending on the circumstances of the community transmission clusters or sporadic cases.
My mistake. So I'll be able to find those online and on the government site or something. Okay.
Yeah, yes.
Appreciate you. Dr.
Sure.
Pete, I believe it's one for yourself. And again, I've been very happy to be able to go out and socialize again. Got to admit, and I'm not going to call any names on it, but nobody seems to have asked me for SafeKey. I mean, I guess that could be on me to, report them. This is for Dr. Pete, sorry. But it's just something that I've noticed, and I'm sure other people have noticed the same thing. I mean, given the way this thing spreads, is there going to be a ramping up of making sure that establishments are following through, not just sporting, but the gamut in terms of actually checking the SafeKey? I've had it printed off and gone to things, and I've just never been asked for it.
Yeah, actually, your question actually has two components to it. One, of course, is making sure the public is aware on how the safe key actually works. And then the second, of course, is enforcement. The unfortunate piece right now is that unless we are aware of particular offenses as relates to safe key not being properly implemented regarding the verification, it's difficult for us to actually address it. But I can assure you that the enforcement team, when they are made aware of any lapses as relates to the proper implementation and verification of safe key, those situations are addressed immediately. But of course, we certainly need the public, one, to be aware on what's required, and then two, of course, when there are situations where the situation is not being implemented properly, that we be properly notified so that we can take the necessary action.
Okay, a tough one to do, but I got you on that. Yeah. Health Minister, I believe this one will be for yourself. Obviously, there's a lot of information you can't give us for privacy reasons, but I'm really curious, particularly with this new variant. A lot of cases are coming from overseas. Where's the bulk of them coming from? Are we seeing them from the UK, US, Canada? If it's the US, any particular gateway city, but where are we seeing a lot of these? Are you able to tell us?
What I can say is you are correct. The majority of our cases, I'd say almost at least half, just over half of the Omicron variant have been imported. And you can appreciate what our gateway cities are. So they would either be coming from the west or the east, but quite a number of them are imported. The majority are imported, yes. A large percentage are imported, and then we have a smaller percentage of community local transmission.
But my question was where? Again, just in
some are coming from the United States, so some of them are coming from England.
Is there a top, I don't want to say offender, but is there a top location that we're seeing most of these cases coming from? I guess
I don't have those numbers in front of me, but if you can appreciate, there's 3 gateway places, so
that's a lot.
It's one of those 3. Yeah, it could be some are coming from the United States and some of them are coming from the United Kingdom.
Yeah, one thing I wanted to ask about, we did see this, and there's only so much we can do, I recognize it, but with the in Delta, when we're really seeing that surge with the Delta cases, we're having a tough time keeping pace with our contact tracers. This one looks like it gets around a heck of a lot better than Delta does. Is there work going on in terms of beefing up our contact tracing so that we don't just end up with that backlog again, that we can't keep up with it?
Thanks, Jonathan. You'll recall the last time when Delta we were in the midst of the 4th wave, and we had indicated that we were going to be utilizing other mechanisms for contact tracing, such as sending letters to those cases, which we will continue to do. We have added more resources, but we will use a lot of the communication mechanisms that we did previously by letter. So if a person is positive, they will receive a letter from the contact testing team, giving them their instructions and asking them to assist in the contact tracing by contacting those persons that they've been in close contact with. So we will continue utilizing that mechanism.
Okay. It's definitely fair to say that Omicron is now the dominant variant that we have on the island.
That's correct.
With these restrictions, what can you speak to what our goal is? Is it just simply to slow it? Are we trying? It sounds like we're trying to slow it. What's the goal of what we got in place now?
The goal actually is for us to try to reduce the severity of the transmission, reduce the factors that could result in community transmission, which could result in higher resource needs of our hospital. It could result in more deaths, and it could also result in increased capacity as it relates to overwhelming our healthcare system. So there's a number of things that we're trying to circumvent by instituting these measures as quickly as possible.
Particularly touching on the hospital, you're saying, obviously we've always said that we don't want it overwhelmed, but we're seeing that vaccinated people are able to pick it up. They're not able to pass it on at all the same way that unvaccinated people can, but it does appear to be happening. The specific things you can speak to in that part.
I'm sorry, I didn't quite understand your question, Jonathan.
Well, unvaccinated people are able to pick it up. Sometimes we don't have symptoms. To a limited degree, we can still pass it on. And the hospital is the #1 priority in terms of keeping it protected. in a potential surge that's coming ahead. Is there anything further you can add to what you've given us these last couple of sessions? Protecting the hospital.
Well, one of our principal objectives is not to overwhelm the healthcare system. You can appreciate if the hospital becomes overburdened like it did in the fourth wave, individuals that may require other types of hospital services, such as surgeries and the like, they are also adversely impacted because they can't have the type of treatment that one would have required because the hospital is dealing specifically with positive cases. You'll recall that the ICU was overwhelmed. They had a second satellite ICU outside. We had issues, unfortunately, where we had refrigeration carts for morgues. We're trying to prevent that particular episode from occurring again, which is one of the reasons why we're moving as quickly as we are to try to circumvent and mitigate against an overwhelming A of our healthcare system, and B, that includes, of course, the hospital.
You spoke last time about people needing a break, and I completely get that we all need a break. But still, I want to go back to it. It's looking more serious than it was just a couple of days ago. Is there any thought to recruiting more people and somehow keeping things going over Christmas, or is it just not possible to do that?
We have, like you said, the numbers have doubled, but many of the persons that have been at the front line doing the immunization program and then doubling up doing contact tracing as well as testing require a break. If we have no resources, human resources, then we can't provide the services that we provide to Bermuda heretofore. So I don't think it's unreasonable for us to ask and allow them to have a couple days over the Christmas holiday so that they can breathe, regroup, and then start this process all over again.
I hear you on that. Mr. Rabane, I had one last one for yourself. It's not a gotcha question, but it does just need to be asked. Obviously, the job fair today was very welcome. I know in advance there are going to be people saying, the cases are rising, why did we go ahead with it? Why didn't we postpone it? Like I say, it's not a gotcha question, but it needs to be asked. Can you address it?
With the job fair, all of the necessary precautions were taking place. It was a safe key event, which would fall on the large event exemptions. And so it went ahead based upon the regulations issued by that would have been issued to any large event exemption. So I mean, even I attended today. I had to show my safe key to get in. I was masked. I sanitized my hands and I social distanced when I was in there.
Minister, thanks for that. Thank you all for your time. Be safe.
Thank you very much, Jonathan. Next up is Gary Foster-Skelton from ZBM.
Good afternoon.
Good afternoon, Gary. We can hear you. You're on, and you can begin your questions.
Thank you very much. And so, first of all, thank you, ministers. Now, COVID cases in Bermuda have seen their sharpest ever percentage increase in recent days, with Delta a continuing threat and Omicron posing a new set of challenges. Acting Premier, you quoted today the head of the World Health Organization that he advised countries that it is better to cancel events now than cancel lives and grieve in the new year. You have implemented new restrictions limiting gatherings. Despite this, and as Jonathan just said, a large event was held indoors today at the Hamilton Princess Hospitality Recruitment Drive, for which I think around 100 people attended in person. My question is twofold. Who granted approval for this event to go ahead today? And in light of the rapidly rising COVID cases, should it have been cancelled?
Again, as I answered Jonathan, the event followed the recommendations. As you can see from the restrictions that we have announced today, there's still opportunities to apply for large group exemptions. And so this event was simply done under the same regulations that would apply for anyone who's applying today, even though we've implemented restrictions. And so I believe it was safe. As I said, it was a safety event. Persons were required to wear masks while they were there. I attended. It looked everyone was following. You couldn't get in the door without, unlike what Jonathan said, where he has never been checked. You could not get in the door without being checked and providing a valid safe key. As a matter of fact, when I was inside talking to some of the hoteliers, they had noted that there had been several people, I believe one quoted around 30 people that have been turned away because they did not have a safe key. And so all that we do and all that we can do is provide the opportunities and provide the guidelines to prevent the spread. And as long as people follow that, we will have a reasonable success at doing that. And the event was well run. The event was followed all of the regulations and guidelines that were put forth. And so I think it was a wonderful event to have, one that gave our Bermudians an opportunity to apply directly with virtually every single hotel in Bermuda and apply for jobs right there on the spot. And so it was a boost, and I'm glad it was well attended. I'm glad it was well organized, and I feel relatively happy at the safety measures that were put in place.
But that event, would it still have been able to take place under the restrictions that are coming in on Thursday?
If under the restrictions that are coming in on Thursday with a large group exemption, I believe that it would have been allowed to happen.
Okay. We are seeing a lot of cases being imported, and it seems students and others returning home to Bermuda are bringing the virus with them. There is no obligation for immunized travelers with a pretest to stay at home and wait for their day 4 test. And we know anecdotally that young Bermudians are getting out and about as soon as they arrive home and subsequently testing positive. Have we succumbed to the inevitable? That is, are we now just accepting that the virus will continue to be imported? Or are there measures we can take to further mitigate the risk in light of the rapid rising cases?
Well, Gary, you speak to something that we continuously mention. As we've continued to learn how to live with coronavirus, there's also a measure of personal responsibility. And personal responsibility means that if you see what's happening, there are things that you can do yourself to mitigate that. And that is, I know personally myself, when I travel, there's no requirement for me to stay home for 4 days, but I do, because I'm taking personal responsibility. And so we urge persons to understand that and actually do it when they do come back. We know that there are going to be persons that once they get their negative test, they'll be out and about, and we'll continue to put things in place to try and mitigate against that. But at the end of the day, it does come down to us. A level of it has to be personal responsibility. I do not want us to be a government that continuously just puts things in place to clamp down, clamp down. There has to be this has to be a partnership as we move forward. The government will continue to put things in place to provide those necessary protections, but is also dependent on the public to do things to help protect themselves and their loved ones around.
So you're saying that even though this is coming in at the border, you're going to keep that period for immunized travelers on their own, at their own responsibility. You're not going to implement like up until day 4 or even up until a negative arrival test, some kind of restriction or quarantine.
Gary, what I can say is that we've discussed at length at the cabinet and at the cabinet COVID committee, which also has the benefit of others advising. And these are the restrictions that we have will be implementing starting on Thursday. And we've also stated that we will reevaluate closer to January 20th when they said, and so what we will do is continuously monitor. And if additional restrictions have to come in place, then additional restrictions will have to come in place. But again, I stress that it is a partnership between the government putting things in place and a personal responsibility of the persons that are on island.
And switching to vaccines, we understand vaccines and boosters will have to be paid for in the new year. Do you have any details on how much it will cost people to get vaccinated, or will this be controlled by private doctors?
Actually, Gary, you're telling me something that I didn't know.
I thought you mentioned this previously, that people would have to have the vaccine privately. Maybe I've misunderstood, but could you clarify that?
Well, certainly. What we're looking to do is to see whether or not we can get the assistance of medical practitioners to administer the vaccine on our behalf so that we can start standing down some. Right now, we've been doing this mass vaccination at the Bermuda College, close to home, and the Pier 6. So what we're as well as KEMH. So what we're looking to do is to see whether or not we can get some of the medical practitioners to assist with respect to the administration of the vaccines. If there is a fee associated with it, there will be some type of recompensation for the persons that are immunizing it, but most of that's covered by insurance. So those are all things that we're looking at. But the main point is that the whole mass vaccination drive, we're looking to narrow it and allow persons to go to their medical practitioners to have the vaccination.
Very well. Are you expecting the large vaccinations taking place at the hospital, things like that? Do you expect to be pulling back on that at all? Or will it still be there whilst the practitioners are doing it?
Those are things that we're factoring in right now, Gary, but at some point, the whole mass vaccination initiatives will start to be scaled down. Like right now, we have just under 200 people that haven't had their second dose, right? And we're still over 70-something% of the general population being vaccinated. So we have secured vaccination for a large percentage of the population. So at some point, the mass vaccinations can be scaled down, and we're hoping that the doctors will come on board to assist in providing the boosters as well as the first and second doses for the few persons that haven't availed themselves of the vaccine. But those are all things that we're looking into, and as it relates to the fees that may be associated with that, through the assistance of the Bermuda Health Council, the regulators, we're looking at what type of reimbursement fee that the insurance companies will cover as it relates to the vaccination. But those are discussions that we're having, and more details will be made publicly when that process has been completed. But the mass vaccination drives, Gary, are going to start to dwindle, but we will still continue to offer the vaccinations. They'll be just done in a different mechanism.
Now, while scientists across the world await to assess the severity of illness caused by Omicron, with initial findings suggesting its symptoms may be milder, are we in danger of becoming complacent and overlooking the proven danger posed by Delta?
I hope not, which is why we continue with these messaging, and people like you that have, continue with the reports and the investigative journalist reports that you're doing to ensure that people recognize that, COVID is here to stay. And the reality is that when we get vaccinated, that will assist us in, minimizing the impact of severe illness and or death. But remember, there are a number of individuals, unfortunately, that live amongst us who, because of their own medical circumstances, are unable to get the vaccine. So when we're encouraging persons to get vaccinated, it's not just to protect them, but it's also to protect the persons that are underage that can't be vaccinated, or alternatively, those individuals that are very vulnerable with autoimmune deficiencies and other types of diseases that prevent them from getting vaccinated. So there is still an element of our population that are vulnerable. And by us immunizing ourselves, not only do we protect ourselves, but we're providing greater protection for those individuals that are unable to get vaccinated themselves.
Now, government's COVID-19 dashboard, which was reintroduced yesterday with the coronavirus update, thank you, shows us very clearly that the vast majority of positive cases are among 10 to 19-year-olds, then after that, the 20 to 39 age range. Virus transmission among children and young people heralded the beginning of our fourth wave of coronavirus infections. Are we seeing a repetition of that pattern?
It's still early days. What we saw in the last wave, yes, you're right, there was approximately 1/3 of the fourth wave cases were young children. In that particular instant, there were quite a number that were in the lower age groups, like the nursery schools. But the stats right now, you're right, the majority of those persons are under the age of 39, with 10 to 19 and 20 to 29 being the higher representation. It's no secret that many of them are schools, and you can appreciate that's where the age goes. The average age, though, Gary, is actually 30 with respect to the positive cases. But, we have seen quite a number of outbreaks within the school systems.
Okay. Switching to the vaccine once again, I've had this question with you, with the government of the last week. When the UK's MHRA gives the green light on vaccines for 5 to 11-year-olds, how ready is Bermuda's vaccine body, BASIP, to distribute the vaccine to younger children? Can we immediately use smaller doses from the stock we have, or do we have to wait for delivery of specific children's vaccines vials from the UK?
Now, as the CMO has indicated, we can use the stock that we have and just reduce the volume.
Mhm.
As soon as MHRA gives us the go-ahead, we will be able to start administering it, and we're certain that some of the doctors' offices, such as the pediatricians who have been assisting us heretofore, will also be stand guard and ready to assist in administering it to their patients, who, of course, the majority of those age group would be within the houses of the pediatricians' offices.
Gary, just going to give you 2 more questions.
Thank you. So one of my final questions, and you have touched on this, we know that right now most infections are among the fully vaccinated, even local transmission, because it's linked to travel. But our biggest risk group in the previous wave were the pockets of unvaccinated Bermudians that included people who are elderly or have comorbidities. Are you doing anything to specifically protect this at-risk group?
Well, in addition to the at-risk group that you're speaking about that are in the nursing homes, who, again, they have their own phases, and no doubt they'll probably implement further restrictions with respect to the phases that they're on anyway, because that is a very high-risk, vulnerable group. But Gary, I think what's important to note is that notwithstanding right now, 13, 14 days or whatever after Omicron was declared by WHO as a variant of concern, the majority of the cases that we have are imported and the majority are vaccinated. But our fear is that, which is one of the reasons why we're implementing these public health regulations, is that this is going to shift, as we're seeing in other jurisdictions, and that the majority of individuals that contract the Omicron variant are going to be persons that are going to be vulnerable, that are not going to be vaccinated. And that's what we're trying to protect now, because we know that that is going to come as sure as day follows night, just like in the other jurisdictions. It starts with the persons that are immunized. Largely, they're the ones that are traveling. And in Bermuda's case, we know that that's the predominant measure in which it's come into Bermuda is by immunized individuals. But it's just a matter of time, regrettably, where it is going to spill into the population of individuals that are not vaccinated. And that is our concern, which is why we continue to impress upon members of the public personal responsibility, ensure that they too are doing what they can to protect themselves as well as protect our brothers and sisters, particularly those that are less vulnerable, that are more vulnerable, excuse me. It's just a matter of time.
And that's the concern, is that you've spoken many times about personal responsibility, but we also we saw in the last wave what that means.
Mm-hmm.
Personal responsibility didn't work for around 70 people that died, perhaps, and I don't want to generalize that that's why it happened, but is there a time when government should step in again?
I'm sorry, what do you mean by step in again?
Step in with stronger restrictions. Is that something you consider?
Well, I think at this point, the restrictions that we have, that we are implementing from Thursday, we're hoping will be sufficient mitigants to control the spread. What we don't want is to see community transmission. However, as has been said previously, these are conversations that we have on a regular basis. And if circumstances dictate that more restrictions need to be enforced simply to try to control the spread, then unfortunately those will be considerations and further difficult conversations and decisions that the government will have to make at the time.
Great. Thank you, Gary.
Thank you, ministers, and have a safe and Merry Christmas.
You too, Gary. Thank you.
To Gary.
Okay, Acting Premier and Ministers, any closing remarks?
Minister Wilson or Minister Peets first.
Mr. Berman, thank you. And members of the media, again, I sincerely hope and pray that we will utilize this Christmas season not only to reflect on some of the challenges that we've had throughout the last 2 years with respect to COVID, but obviously to reflect on our blessings and recognize that we have personal responsibility and that we need to ensure that we are our brother's keepers. And by doing that, we can try as best as possible to keep Bermuda safe, particularly as it relates to the spread of COVID. And again, I wish everyone a Merry Christmas and a blessed and prosperous New Year. Thank you, Mr. Berman.
Thank you. Minister Peets, do you have anything to share?
Yes, thank you. Just in closing, of course, over the last couple of months in particular, we've seen some messaging going around on WhatsApp regarding guidance regarding COVID. My encouragement, of course, to the community, of course, is to always check your sources, particularly contacting the government or whatever relevant ministry or department to ensure that the information that you are receiving is the correct information so that your event or your program or your camp is operating under the appropriate government guidelines. Otherwise than that, we certainly want to thank the Minister of Health, her entire team for all of the hard work that they've put in this past year. And we certainly want to wish everyone a safe and Merry Christmas.
Acting Premier?
Thank you. Bermuda, I just want us to reflect on the fact that we've been going through this for quite some time. And the idea of COVID fatigue is not lost on me. I understand how we feel and how some of us are thinking that we're possibly being punitive. However, everything that we do, everything that we say is about protecting life. When I think about this time of year and reflect on those 106 families that will not have the opportunity to celebrate one more Christmas with their loved one because of the scourge of coronavirus, it makes me want to be more personally responsible for my actions so I can be part of the solution to help not have that happen to any other family. I urge personal responsibility. I urge people to recognize that everything that they do cannot be just about themselves. Think about the persons next to you. Think about the persons around you. Continue to be safe. Continue to wear your mask. Continue to sanitize. Continue to social distance. Take care of yourself. Build up your immune system. And if the vaccination is for you, do your research and make plans to get vaccinated so you can help to reduce the amount of sickness and potentially deaths that could occur from that. To all of those hard workers for the last 2 years that have been doing everything to put Bermuda on the map as one of the best run testing facilities in the world. I thank you for the hard work that you're doing. All of our medical staff that have had to put in the countless nights and deal with the issues at the hospital, such as the deaths and the grieving families and the like. I thank you. I thank my fellow ministers for the hard work that they've put in for the last 20 months battling this coronavirus scourge. And to all of Bermuda, I thank you for doing what you need to do to protect us against what is surely something that none of us would have ever thought was possible 2 years ago. With that, I will continue to urge personal responsibility. Look out for yourselves, look out for your fellow Bermudians. Please have a prosperous Christmas and a happy New Year. God bless you, everyone, every single one of you, Bermuda. Thank you.
Thank you very much, Acting Premier and Ministers. And with that, that is the end of our press conference. Bermuda, be safe and have a Merry Christmas.